Everything isn't broken in Canada. The very idea is ridiculous when you look around the world, when you see the number of people who come to our country for a better life. But the same quality of life doesn't exist for everyone here, and some things are broken, just not the way you might think they are. I'm here at the South Riverdale Community Health Center, and beside me is a list of names. These are names of people who have died in the opioid crisis. You should read these names. They are a fraction of the tens of thousands of people across our country who have died because of a poisoned drug supply. These were preventable deaths. The poisoned drug supply that exists, it exists because we have vilified and criminalized certain substances and the people who use them. We've pushed people away from help, the very help that they need. In response, our federal Liberal government has rightly changed the laws recently to divert people who use drugs out of the criminal justice system and towards a more health-focused approach. One, by the way, that is endorsed by the National Association of Chiefs of Police. It's not perfect. Criminal law is still on the books. We could do better, but it's a significant step forward, and one I am proud to say I had a hand in drafting. Now, we also expanded harm reduction and safer supply across this country. Safe consumption sites like South Riverdale here, they are saving lives. But the response is again insufficient to meet the reality and scale of the challenge before us. Of the $500 million we promised in the last platform, only $100 million has been delivered to date. At the provincial level, Doug Ford's administration, they are entirely missing in action, despite the fact that the provincial government is most responsible for managing and addressing this crisis. When they first took office, the Ford administration actually canceled planned spending on mental health. Doug Ford said he was dead against safe consumption sites, a revealing choice of words. Since that time, his administration has made it harder to open safe consumption sites. They've entirely ignored safer supply, despite a toxic supply circulating our streets, and they have unfunded mental health and treatment options, downloading these challenges to municipalities that are ill-equipped to deal with them. We see the results in our downtowns and on our streets. We deserve stronger leadership. The answer isn't to dehumanize people who need help. The answer isn't to arrest our way out of these problems. Police leadership agrees. Medical experts agree. Parents and families who have lost loved ones agree. We do know what works, whether it's alcohol addiction or any other substance use challenge. The answer is a public health approach grounded in compassion and evidence. At the provincial level, at all levels of government working together, we need to treat people with respect. We need to provide housing options and support. We need to ensure that there's access to the supports that people need, whether it's clean needles, a clean supply, so that people don't die before they're ready to get the help that they need, and that treatment options and mental health supports exist when people are ready for that help on demand. Without beds, treatment, and support, we're going to continue to see people on our streets, see our communities and downtowns deeply challenged, and to see lives lost. The provincial Conservative government needs to stop cutting and to start caring for people in need. The federal Conservatives need to stop finding new ways to fight an old and failed war on drugs, and our federal Liberal government needs to treat these lives lost as the crisis that it is. We need brave and committed leadership, and I will remain committed. I have been committed. I will continue to be committed to deliver on this issue, to protect public safety, and to deliver public health, to treat all substance use as a health issue, to expand harm reduction and treatment options, and to save lives.